Hello. Today we're talking about hip bursitis, or as Sam calls it, brositis. If you're a guy, you get brositis. So that's usually pain out on the lateral trochanter, greater trochanter of the hip, or you can just have lateral pain in the muscle. So there's a lot of reasons for that. Sometimes it's actually a hip problem. Sometimes it's just overuse, too much walking or running, or certain exercises. It also can be a problem within the pelvis of the lower back that may be causing pain or referred pain into your lateral hip. Sometimes if it's point tender, specifically right around the trochanter where the bursa sits, which a bursa is just a sac of fluid that helps lubricate the tendon, and they inject it and it feels better, that's probably what it was. The problem is that won't always last until we fix the hip. So you have to make sure you have good range of motion in your hip first. Make sure you have good hip abduction on both sides, right? You compare that to the other side. You also make sure you have good hip extension, where your leg can go back behind you, and not only do you have it, but can you stretch it and spring it and it still feels okay. You can also check the rotations in your hip by doing these, right? Push down, evaluate on either side. Oftentimes with this type of a problem, you'll be very tight in that rotation. You can also assess it this way as another option. You can also use these same tests as exercises, right? Stretches, you hold them for 10 seconds, repeat them 10 times, and keep working on that. And make sure that you have proper adequate range of motion for all these hip motions so you can free up your hip joint. This way your muscles won't have to work as hard. Now in terms of exercises, you can do bridging for strengthening. You can eventually do single leg bridging on either side, do sets of 10 of those. You can lie on your side. I'm going to demonstrate on my right side in this case for clams, right? You can even put a band between your knees and do clam exercises. This is the hardest one of all, actually, is the side lying straight leg raise for abduction, because there's actually a lot of load on that muscle. So if this hurts, just avoid it. But if you can do a couple sets of 10 without it hurting, that's great. Also, squats, eventually step ups, single leg balance are all great, but more advanced exercises you can do for your bursitis/brositis. Give those a shot, provide some comments, let me know how it works out.